Hi everyone, so today we're going to be looking at a key study, a classic study in the clinical approach of Edexcel spec psychology, and we're going to be having a look at Rosenhan's study, which we're going to have a look at the description and the evaluation of. So let's start off by looking at the aim of the study. So Rosenhan wanted to test the reliability of diagnosis of mental health. So he wanted to see if medical professionals clinical psychologists could tell or distinguish the sane from the insane in a clinical setting, in other words, in a hospital. You also want to investigate the effect that labeling has on some of the patients in mental institutions and also on medical diagnosis. So for the study, 8 people were used, which included 2 graduate students, 3 psychologists, pediatrician, painter, and a housewife. All of these people that were used were mentally stable. There was no mental health problems with either of them. And this included Rosenhan himself, also posed as a participant. So as part of the study, 12 different hospitals were used across 5 different states in the United States. And the reason why Rosenhan used 12 different hospitals was to really increase the generalizability, to see if all 12 hospitals respond in the exact same way. Okay, so some were obviously new hospitals, others were fairly old, some were poorly staffed, others had a lot of staff, some were private and some were university funded as well. So a range of different hospitals used. So those 8 pseudo patients, so obviously not real patients, but pseudo patients, they found 12 different hospitals across the US, and they complained of having auditory hallucinations and hearing voices, specifically empty, thud, and hollow. Obviously, each patient gave a false name, false identity, so that the hospital couldn't suspect or trace anything back to them. And the pseudo patients, on the basis of these hallucinations that they were hearing, were given clinical interviews where they had to come in and meet with the clinician. They reported the symptoms, and all of those 8 patients, pseudo patients, were given a diagnosis of schizophrenia, with one of those patients being diagnosed as manic depression. So all of those 8 patients managed to get themselves admitted to a mental institution or hospital on the basis of hearing those 3 words. So when they were admitted into hospital, those 8 patients started behaving normally. They said that they were not hearing any voices, and they said that those auditory hallucinations had stopped. They also obviously took down a notepad and pen along with them to record what they heard and saw within the institution, within the hospitals, including other patients, the way staff were sort of approaching them. And they tried to obviously do this covertly so as to the doctors and nurses wouldn't suspect that they were obviously pseudo patients. And if staff did detect them, they carried on recording things openly and overtly. As soon as they were admitted into the hospitals, all 8 pseudo patients requested the doctors and nurses to be discharged and that there was nothing wrong with them. They secretly disposed of any medication, obviously down the toilet, so obviously they didn't actually take any medication. But otherwise, their behaviour was normal, they were friendly, they were polite, they did everything that was asked of them. They did not display any behaviour which was disruptive or characteristic of having schizophrenia. Rosenhan himself carried out 2 structured observations during the study in one of the hospitals as a pseudo-patient. And in 3 of the hospitals, a record was kept also of how many patients voiced suspicions. So they wanted to really see if other patients would recognise that this person was obviously a pseudo-patient and not really anything wrong with them. Also, they recorded how much time staff spent on the ward, also interacting with the patients themselves. Out of all the patients, 30% of the actual patients did voice their suspicions about the pseudopatients. So they did suspect that these patients were not real patients, and that they were obviously sane, suspecting that they were possible journalists, professors, inspectors of some sort checking up on the hospital. Now, what the results showed were that, firstly, all hospitals, all 12, diagnosed the 8 patients as mentally ill, even though they weren't. Okay, and this was based on the one symptom, auditory hallucinations. 11 of them diagnosed schizophrenia, and one hospital, which was the private hospital, actually diagnosed manic depression or bipolar disorder. The pseudopatients were discharged with a diagnosis of schizophrenia in remission. And what that means is the person has or had symptoms of schizophrenia but no longer have them. None of the staff recognised that the pseudopatients were healthy. It took between 7 and 52 days after being admitted for the pseudopatients to be discharged, with the average stay being about 19 days. So as you can imagine, it would be very difficult for a patient to convince the doctors and nurses that actually they were sane and there was nothing wrong with them, which is probably what every mentally ill patient will do anyway. So, it's a very, very difficult thing to do, really, to convince somebody that you are sane, especially within a mental institution. Rosenhan also carried out a follow-up study. So after informing the hospitals that about the results of the study and that they were obviously not real patients and that they were pseudopatients, he revealed the results to the hospitals, and obviously they were quite shocked, surprised. But they did agree to a second study. And this time they were told that over the next 3 months we will be sending some pseudopatients, and they obviously wanted the hospitals to be a bit more aware and possibly note down which of those patients they thought were pseudopatients. So staff were issued with questionnaires to rate each patient on a 10-point scale to say if they suspected that they were a pseudopatient. And in the follow-up study, one member of staff at the hospital reported that 41 out of 193 patients were fake. So out of the 193 that were sent, one of the staff said that 41 of them were pseudopatients. When asked by the psychiatrists themselves, psychiatrists said about 23 of them possible would have been pseudopatients, and further 19 considered fake by other members of staff. In actual fact, Rosenhan did not send any pseudopatients to the hospitals. Okay, so that was just the hospitals themselves having suspicions about real patients themselves. Here is a video on Rosenhan's study, which is quite a good watch. So watch that. It's a good video. It gives you a quick summary of Rosenhan's study and a bit more detail. And really the conclusion from this study is that Rosenhan claimed that hospitals could not distinguish between sane and insane patients in hospitals, and they really did struggle to identify or distinguish really between the insane and sane patients. So he felt the hospital environment led to depersonalization and segregation, and often patients were treated as a one group rather than individually. So really evaluating the study now. So there were some good things and not so good things about this study. So let's have a look. Rosenhan used a naturalistic observation. In other words, it was carried out in a realistic setting. 2 people, 2 humans, 2 participants. The mental institution, which was covert. Staff were unaware of pseudopatients, being the researchers. Therefore, we've got a greater ecological validity here in the study. The researchers collected both quantitative and qualitative data. So there was only one patient per hospital. Therefore, reliability and validity can be questioned because the patient may have missed out on some information because obviously being the only observer there, it's difficult for them to gather all the information. The study really was a breakthrough really in clinical psychology because it really picked up the fact that there is a problem with the diagnostic system used by clinicians, and therefore it did lead to some changes being made to the DSM, and psychiatrists obviously did fail to make accurate diagnosis. So this kind of pointed directions towards the DSM, and the fact that it did need to be revised. Ethically speaking, you could say that the hospital staff were deceived about pseudopatients, so they obviously wouldn't have been very happy to find out that they were deceived. The doctors and nurses could not obviously consent to take part or even withdraw because they obviously didn't know it was a research study. The other patients had obviously no possibility of consenting either or withdrawing because there was really no point in telling them about the study. The sample of hospitals, obviously using 12 different hospitals, was generalizable. So obviously a variety of different institutions from all over US were used. And yes, we have increased generalizability. However, the fact that it was limited to the US culture, you could say, could obviously lack some generalizability as well. So it can only really be applied to explain diagnosis in the United States and not any other country. Okay, so there you go. That's a summary really of Rosenhan's study. Okay.